Hey, this is Doc JT. We're going to talk a little bit about dry needling and electrical stimulation. So what I have here is about a 1.5-inch very fine filament needle that can be used for acupuncture, but I like to use it for tight muscle groups. And what we're going to focus on is this left lower back. This is called a guide tube. And basically what I'll be doing is finding a few different areas that are the most spastic or tight, and I'm just going to tap that needle right into the tissue. I'm going to give it a little squeeze, and we're just going to gently drop that needle into what's called the outer paraspinal muscles, and I'm going to be doing some pistoning back and forth, and I'm just gently massaging that muscle. And what dry needling is really designed to do is fatigue the muscle so it lets go and quits pulling on the spine. So I'm going to focus on a couple different areas. Again, placing the needle in the guide tube and a gentle tap, squeezing of the tissue, and the needle will just gently insert into that muscle. And we're just going to trace a few different areas. The purpose, again, behind dry needling is to go deep enough where we can get that muscle to respond, usually by a twitch or by some type of reflex. And it's very comfortable, very, very effective, especially when we use our muscle stimulation. So the final area, as we draw this through, we'll be running right alongside that left side. So again, a gentle insertion. We're all done there. And then what we're going to do is we're going to take our 2 electrodes and we're just going to gently clip them onto the needle. Good. We're going to be using our modulator, and we're going to stimulate the muscle, which you'll see in just a moment. And usually what I'll do is I'll take the level up to a comfort level of a 6 or a 7 based on the patient's point of view. And so we're just going to gently turn up our dial.
That's good there.
And the patient will basically, at that point, say, that's good, feeling comfortable. And what's happening is we're getting some deep penetration of the muscle stimulation through these 2 needles. The other 2 needles, we'll take the next clips and we'll apply them again in a pattern that I've deemed necessary for the maximum results. And we're going to go ahead and bring up the channel 2.
That's good.
And the patient, again, says that's good, comfortable. We'll usually leave that there for about 10 minutes or so. Blood flow is going to be circulating into the needle points, and the muscle will let go. And once the patient comes up off the table, they'll feel much more relaxed, and most of the time the muscle pain is gone. It works wonders. So dry needling, if it's for you, let me know.